Welcome to Accommodations 101 training, an overview on disabilities and easy ways to include everyone. Frequently during this training, I will ask you to stop and reflect on some times that working with a certain diagnosis has challenged you or presented you with a positive experience. Oxford Dictionary defines a physical or mental condition that limits a person's movements, senses, or activities as a disability. The ADA defines a person who has a physical or mental impairment that substantially limits one or more major life activities. This includes people who have a record of such impairment, even if they do not currently have a disability. It also includes individuals who do not have a disability, but are regarded as having a disability. The ADA also makes it unlawful to discriminate against any person based on that person's association with a person with a disability. Here are some types of disabilities. Mobility and physical impairments, upper limbs, lower limbs, manual dexterity, disability and coordination with different organs of the body. Individuals can either be born with these impairments or acquired throughout the lifetime. People with broken bones fall into this category. Please take a moment, pause the video to stop and talk with anyone you are in the room with, or reflect on a time when working with someone with a mobility or physical impairment has presented you with a challenge or a positive and rewarding experience. Brain injury. Acquired brain injury is a degeneration that occurs after birth. A traumatic brain injury is caused by external forces damaging the head and neck. This can either be during or after birth. It can range from mild to severe and can result in emotional dysfunction and behavioral or emotional changes. Visual impairment. Any change in vision that results in functional difficulties in day-to-day life activities. This can be hereditary, degenerative, or caused by trauma, and can range from minor to complete blindness. Hearing disability. Any type of impairment to the individual's ability to hear. This can be evident at birth or occur later in life from illness or trauma. Supports include hearing aids, cochlear implants, supported communication via devices, and/or sign language. Psychological disorders. Disorders of moods or feelings that can be either short or long-term. Deeply inadequate patterns of behavior and thoughts of sufficient severity to cause significant impairment of day-to-day activities. This includes, but is not limited to, schizophrenia, mood disorders, anxiety, depression, eating disorders, bipolar disorder, personality disorders, or obsessive-compulsive disorders. Please stop and take a minute to think about an experience that either challenged you or presented you with a positive or rewarding experience. Developmental and intellectual disabilities, also known as general learning disability and mental retardation, are generalized neurodevelopmental disorder characterized by significantly impaired intellectual and adaptive functioning. It is defined by an IQ score under 70, in addition to deficits in 2 or more adaptive behaviors that affect everyday general living. Intellectual disabilities affect a wide range of functional skills, such as life skills, social skills, cognitive functioning, communication, and emotional regulation. Now we're going to review some types of intellectual disabilities. Autism. Autism is a neurodevelopmental disorder characterized by impaired social interaction, verbal and nonverbal communication, and restricted and repetitive behavior. It is an umbrella term for autism spectrum disorders, including childhood disintegrative disorder, pervasive developmental delay, and others. On the right, you'll see some facts about autism. Please take a moment to think about a time when you were working with an individual diagnosed with autism and were challenged or presented with a positive and rewarding experience. Here are some common traits and regularly used supports for folks with autism. Attention deficit hyperactivity disorder. This is a common comorbidity. ADHD is a disorder characterized by lack of ability to focus or pay attention, difficulty controlling behavior, poor impulse control, and hyperactivity. Here are some common traits and some regularly used supports for folks with ADHD. Please take a minute to review them. Cerebral palsy is a disorder that affects muscle tone, movement, and motor skills, as well as vital functions that involve motor skills and muscles, such as breathing, bladder, and bowel control, eating, and learning. On the right are some facts about cerebral palsy. Here again are some common traits and regularly used supports for folks with cerebral palsy. Fragile X syndrome. Fragile X syndrome is an inherited genetic disease passed down from parents to children that can cause learning disabilities, developmental delays, and social or behavioral problems. Boys with Fragile X syndrome usually have some level of intellectual disability. Girls may have some intellectual disability or learning disability, or both, but many with Fragile X syndrome will have normal intelligence. They might only be diagnosed with Fragile X syndrome if another family member has also been diagnosed. Here are some facts on the right about Fragile X syndrome. Please take a minute to review them. Here are some common traits and regularly seen and observed abnormalities for folks diagnosed with Fragile X syndrome. Down syndrome, or Down syndrome, also known as trisomy 21, is a genetic disorder caused by the presence of all or part of a third copy of chromosome 21. It is typically associated with physical growth delays, characteristic facial features, and mild to moderate intellectual disability. On the right are some facts about Down syndrome. Here are some common traits and regularly used supports for folks with Down syndrome. Prader-Willi syndrome is a genetic condition whose cause is quite complex. It occurs when there is a lack of expression of one or more genes in a specific region of chromosome 15 that was inherited from the father. The precise location of the abnormality being designated as 15, Q11 to Q13. On the right are some facts about Prader-Willi syndrome. Here are some commonly observed traits and regularly used supports for folks with Prader-Willi syndrome. Disability and abuse. Over 70% of people with disabilities report that they have been victims of abuse. More than 63% of family members said their loved one with a disability had been an abuse victim. Focusing exclusively on those with developmental disabilities, 62.5% of this group said that they had experienced abuse of one type or another. Of the various types of abuse, victims with disabilities reported verbal emotional abuse, 87.2% of the time, physical abuse, 50.6% of the time, sexual abuse, 41.6% of the time, neglect, 37.3% of the time, and financial abuse, 31.5% of the time. It is important to note when working with individuals with disabilities that they often may not be able to express or communicate if they have been abused or the level of abuse that they have gone through. They also may not be able to articulate or express how this abuse has affected them and manifested in their personality. Please take extra caution when working with folks with disabilities to remember that there may be things that you will never know about them and that they may never be able to express to anyone. For this reason, you should take extra caution and care. Co-occurring disorders. Many individuals with disabilities with intellectual disabilities also have another disability. Studies demonstrate rates of comorbidity for children and adolescents between 30 and 50%. These disorders can be caused and exacerbated by social, therapeutic, and family conditions. Bullying. Children with attention deficit or hyperactivity disorder, ADHD, are more likely than other children to be bullied. They are also somewhat more likely than others to bully their peers. Children with autism spectrum disorder are at an increased risk of being bullied and left out by peers. In a study of 8 to 17-year-olds, researchers found that children with ASD were more than 3 times as likely to be bullied by their peers. This again speaks to what we mentioned in the previous slide about abuse. You truly may never be fully aware of what someone has gone through. And for that reason, please take extra care when working with individuals with disabilities. Poverty and intellectual disability. Epidemiological studies have consistently reported a significant association between poverty and the prevalence of intellectual disabilities. The available evidence suggests that this association reflects 2 distinct processes. Poverty causes intellectual disabilities, an effect mediated through the association between poverty and exposure to a range of environmental and psychosocial hazards. Families supporting a child with intellectual disabilities and adults with intellectual disabilities are at an increased risk of experiencing poverty due to the financial and social impact of caring and the exclusion of people with intellectual disabilities from the workforce. Legal supports. Currently, the Americans with Disabilities Act stipulates legal supports for the rights of people with disabilities. This act covers things like banning discrimination, ensuring reasonable accommodations to make employment possible, mandating architecture to ensure accessibility, TDD and closed captioning services, and accessible public transportation. Educational supports. The Individuals with Disabilities Education Act, also known as IDEA, is a national legislation that ensures children have access to free and appropriate public education. Entitlements are early intervention, individualized education plans, extended school year, transportation, therapies, technologies, etc. Children are also entitled to the least restrictive environment, but specialized schools, if required, are paid for by the school district. Parent perspective and some considerations. Social services systems are incredibly complicated. From birth to school age, children go through 3 different systems with different providers, plans, and entitlements. Schools rarely offer all entitlements, which means parents have to educate themselves, usually independent, and then fight for services, often leading to due process and lawsuits. The more lawsuits a school has, the less money it has for education, which then leads to more lawsuits, further depleting resources. Transition services vary widely in quality and parent education. Adult systems have no entitlements and require different and often conflicting services, such as medical assistance, the Office of Vocational Rehab, and Social Security. An important note is that the Office of Vocational Rehabilitation is the office that helps and assists individuals and adults with disabilities in finding employment and gaining the supports that they will need to accomplish this. It is also very important to remember that as an employee in this field, you should educate yourself on all of the processes and not just the ones that you work in. Having a full picture of the system and what parents go through to navigate it will allow you to better serve the individuals that are on your caseload, in your classroom, or that you work with. Please take a moment to think of some common accommodations that you have witnessed or that are present in the environment that you work in. Then take a moment to research some that you were unaware of or that you think may benefit the individuals that you serve. Diagnosis doesn't matter. When it comes to finding adaptations that work for individual children, your understanding of their specific diagnosis is important with regard to safety. Accommodations are most effective when they address the function of the specific behavior that is a barrier to participation. not what their diagnosis is. Visual accommodations. Keep the floor clear of clutter and tripping hazards. Do not hang anything from the ceiling that a person with a visual impairment could hit. Keep the layout of the room constant and provide instruction and/or time to acclimate when it changes. Modify light sources when possible to reduce glare and make information more accessible. Use large print and other assistive technology when possible. Provide verbal directions with regard to hazards. An example, there is a puddle on your left in about 3 steps. It's also important to take note of the type of accommodations that a person with a visual impairment might like for you to assist them with. Knowing a person's level of comfort and interaction with their environment will help you appropriately accommodate them. Auditory accommodations. Present information visually. Understand that the deaf culture is very vibrant and proud, and most people do not see deafness as a disability. Allow students to sit where information is most accessible to them. Use visual emergency systems, an example, flashing fire alarms. If possible, learn the signs for presented activities. Consider safety when in active programs. Deaf people cannot access information outside their field of view. Please take note that learning a few signs can take a very small amount of your time and go a long way in establishing a solid connection with the individuals that you serve. Sensory processing. Use alternative seating, wobble chairs, exercise balls, standing desks. Attach a stretchy band to chair legs for resistance stimuli. Provide a weighted lap pad, vest, or wiggle cushion. Allow the child to use unobtrusive fidgets. Provide headphones for students distracted by noise. Provide instructional space visually defined that allows for movement. Be creative with positioning in programming when possible, such as laying on the floor to draw or color. Also remember that sensory processing needs change over time. It is important for this reason to have regular conversations with your student or the individuals that you support and their caregivers or family about changing needs and reaction to environments. Self-regulation. Create routines and stick to them. Also allow for breaks at either scheduled times and/or develop a universal system for requesting a break. Provide advance warning when there will be a change in schedule, and be as consistent as possible with providing environmental supports for defining expectations, such as visual schedules, timers, rules posters, or presetting, also known as verbal warnings. Adaptations for physical impairments. Keep the floor as clutter-free as possible. Ensure that all spills and other messes are cleaned up thoroughly and promptly. Know the location of elevators and emergency exits and train the students on where they are. Communicate on equal levels. Ensure that all pathways are at least 36 inches wide and corner areas are 60 by 60 per turns. Allow more time for transfers and travel between activities and locations. Make sure that all tables and other activity surfaces have space for footrests underneath, usually 18 inches of space. It's also important to poll the individuals, families, caregivers, and students that you work with to ask if there are any simple adaptations that may be customized to them and make them feel more comfortable in this environment. This also will go a long way to establishing rapport and connection with the individuals that you serve. Have multiple choices for writing, art, or other fine motor implements. An example, pencil grips. Use the closed fist rule. Ensure that activity supports are only supplementing weaker skills. Partnering activities are great as long as the whole group is partnered. Be patient with frustration. Remember that students may become frustrated, and it is your job as a provider to help them work through this and achieve success. Offer various sizes of activity materials available. Social skill accommodations. Have consistent social rules that everyone is expected to follow. Make sure they are clear and predetermined in their consequences for rule breaking that everyone follows. This is to include staff. This can go a long way in establishing rapport and connection with clients. It also will help mitigate behaviors. If individuals see a staff performing an activity that they themselves are not allowed to perform, how do you think that will make them feel? Remember that reinforcement is not generalizable, and punishment is not. Use positive supports for longer-term results. Provide daily topics or themes for discussion, and provide visual cues. Beginning conversations with peers is difficult for many people with social skill deficits. When possible, relax instructional control and provide choices. Allow extra time for answering questions, following directions, and completing tasks. Provide brief but frequent feedback on both good and unwanted social behaviors, being clear on what the student is doing well or what they could do instead. Provide feedback for all children in one-to-one settings when possible. It is usually very aversive to be corrected or disciplined publicly. Please keep this in mind. Never underestimate the importance of your relationship with the child, and pay attention to how your behavior impacts theirs. Often the easiest and most impactful adjustment you can make is your own reaction. As we discussed earlier in the training, there are many, many, many tools and tricks that you can use to establish rapport and connection. A strong rapport and strong connection with the individuals you serve and the caregivers and families that support them will go a long way. Cognitive adaptations. Offer choice in activities so kids can access information at a level that is comfortable to them. Decrease language. Saying things as simply as possible makes the information easier to process. Allow time for processing directions or answering questions. In order to decrease classroom disruptions, provide independent environmental stimulus when possible. Present information in multiple modalities whenever possible, and always make sure there is an interactive feature during lessons. Make as many accommodations universally available as possible. Allow frequent breaks. Decrease task demand to make projects or assignments possible, and be careful that this does not become exclusionary for the student. Be patient with anxiety if present, and realize this looks different on different people. Preset for transitions, time left in an activity, etc. Use schedules. Utilize individual supports and other environments, in example, IEPs, or behavior plans, home-based treatment protocols, etc. Now that we've come to the end of the slideshow, please take a minute to go back and review any slides that you feel we went through too fast or you would like more information on. Also, please feel free to reach out via email at nicholas.larcenise, nicholas.larcinese at variety, VARIETY, phila, PHILA.org, or by phone at 610-507-1821. We hope you enjoyed this training and that it benefits yourself and the individuals that you support. Thank you.